Good evening. It's my great pleasure to welcome you to the ARCO Forum. And on behalf of the Institute of Politics, as director, I welcome you. The purpose of the Institute of Politics is to inspire young people to public life, which is a challenge, as I'm reminded, in these times. And so it is particularly apropos that the secretary has spent the entire day with the undergraduates. Really a wonderful, unselfish day, and you've given very much of yourself today to your handlers, and as she refers to the two members of the Student Advisory Council, who have been wonderful, Mark and Saloni. And she's given much of herself today, as she always has. I have come to, it's not my purpose to introduce her, Julie will do that, but I have a word. I have come to know her professionally, but more so I've come to know her as a person. She and I joined together in three, I think, remarkable performances for the arena stage for charitable purposes. The best description I can say is that she loves this stuff. She is an actress. She is good. She's full of vim and vigor, and her costumes are outrageous, and her props, her sight gags, and she's good. And we had a lot of fun together, and a lot of other extraordinary skills. But I admire her immensely, and you will see why, those of you who have not had the opportunity to hear her. And she is very candid, very clear, very practical, bipartisan, sincere, loyal, and a very fine administrator and a fine person. And again, since I came here first as a citizen in '84, always there has been controversy with my remarks. There will be controversy, apparently, perhaps, in some degree tonight. That wouldn't surprise any of us. It's called democracy. But the worth of this forum is respect for the speakers. Perhaps not their ideas, but themselves. And courtesy and respect and civility is a learned experience. And this is one of the finest places of learning in the United States. And I now introduce to you Julie Wilson. She is the Associate Academic Dean of the school, Director of the Wiener Center for Social Policy. Julie's research focuses on urban, family, and welfare policy. And prior to coming here, Julie directed the Office of Program Planning, Analysis, and Development in New York. And it is one of those things in public life that I will scramble toward the airport to catch a 7 o'clock flight, and the secretary will have an 8 o'clock flight, but I leave you with a remarkable audience of remarkable students, and hope the questions will be first addressed from the students, and if I were here, I would assure that. And Julie, I know you'll do that. Is surrogate work beautifully. Thank you very much. And hello and goodbye.
Nice to see you. Bye-bye. It's hard to fill Al's shoes. It's even harder to speak into Al's microphones. Most of us are a lot shorter. I am absolutely thrilled to be able to introduce Donna Shalala this afternoon. She was, as many of you know, she's had a long career. I couldn't possibly tell you everything. She's been active in the public sector, in the academy. She was the chancellor of the University of Wisconsin at Madison, the first woman to hold this position in a Big Ten university. She was president of Hunter College in New York City. She was working for HUD as the assistant secretary for policy development and research. She served in the Peace Corps. She's been a director of the American Stock Exchange. You name it, Donna has done it. But that really doesn't describe what Donna means to a lot of us. I think particularly those of us who are women admire Donna for her leadership, her intelligence, her political savvy, her guts, and her sense of humor. And that's what I want to talk about for just a moment before I turn the podium over to her. I first met Donna when she was at Hunter College, and I was working for the state of New York. But actually, Donna had had an important impact on my life before that, because I was a graduate student at the City University of New York when Donna served on the Municipal Assistance Corporation, the hastily formed corporation to prevent New York City from going into bankruptcy. And the headlines all the time were, we could help save New York by getting rid of the graduate school at the City University of New York. And we used to go from day to day wondering if we would have an institution from which to get a degree or not. And Donna, thank you, I did get the degree. Donna also holds the distinction, when she was at the University of Wisconsin, of being the first woman president to fire the football coach. Now, if you know anything about Midwestern football, you know that this took an enormous amount of guts. I don't know if the team went on after that to win. They did. But just to make sure that she was welcome again in Wisconsin, Donna, as many of you know, has been advertising milk, one of the major products. So you can go home again to Wisconsin. And those of us in social policy were thrilled. Many of us view Donna's milk commercials as a sign that we have made it, that we can have our secretary on the backs of all the big magazines. Lest you think she's only a one-sport athlete, she's a two-sport athlete. Donna distinguished herself this spring by throwing out the first baseball at Camden Yards, and we hear from the pitcher's mound it was a strike. So, Donna, a side of you they've never seen. But welcome to the Kennedy School.
Thank you very much. Thank you very much, Julie. Thank you for your gracious invitation, and thanks to the Institute of Politics for this wonderful opportunity to speak again at the ARCO Forum. I was, of course, for many years on the visiting committee of the Kennedy School, so I sort of know my way around, but there are a new generation not only of students but of faculty. Today I came to Harvard on the recommendation of some of my friends to talk about some of my experiences in Washington. This will be slightly less substance than I usually do, but let me start by noting that this nation's capital not only attracts the best, but sometimes loses the best. And there are great public servants and scholar teachers like my wonderful friends David Elwood and Mary Jo Bain, who were colleagues of mine, of course, in the department, who are now back at Harvard, but whose intelligence and integrity and friendship and loyalty still represent the standard that the rest of us try to meet. And I miss them desperately and the chances to learn from them. I had my own ongoing Harvard seminar in the department for a very long time, and they are welcome back anytime, any place I am. I'd love to have a chance to work with both of them again. I also want to note the presence of my friend Maxine Isaacs, who I first met in the Carter administration a long time ago, when we were little, and still had more energy. And she is a wonderful addition, of course, to Harvard, and knows more about politics and journalism and the intersection between the two than anyone I know. And then there are the tall cowboys with a sense of humor and the grace of self-examination, like the man who just left. There weren't many to begin with in Washington. There's one less now, since Alan Simpson has come to Harvard. I actually always believed that he was a closet Democrat. He sort of plain-spoken in the tradition of Harry Truman. Who else? You would never hear Newt Gingrich say, "I sometimes don't know when to stuff a sock in my mouth." It's a great honor to join all of you at the Institute of Politics, to look back and look forward a little bit at the making of public policy in Washington. Let me begin with a simple proposition, though. No one, whether in government or in the private sector, gets it right all the time. Our best computer programmers wrote billions of lines of code in the 60s and the 70s, apparently thinking the world would stop at midnight 1999. Last summer, there were predictions that the movie The Titanic would sink at the box office, and just a couple of weeks ago, the astronomers made headlines around the world by announcing that an asteroid headed towards Earth would barely miss us. The fact is, the next day they updated the numbers. It missed us by 600,000 miles. I'm not an astronomer, but I understand that determining the course of that asteroid is not as simple as drawing a line from A to B. But it is at least a puzzle with a straightforward solution. were it only so with people. Think about the real Titanic. Engineers knew exactly how the ship would break up and how long it would take to sink, but no one could predict how the passengers would react, who would panic, who would show courage, and when the will to love would be stronger than the will to live. We're gripped by these questions because they measure who we are and our will to overcome. And I've spent most of my adult life sort of going back and forth between making public policy and being a student of public policy. And after many years of doing both, I can tell you that solutions are rarely rise to the surface with mathematical precision. And yet, time and time again, I've seen leaders in both political parties and many top policymakers, like the ones that I've just mentioned, rise to the occasion, put the country above political party or ideology, and better the lives of millions of Americans. I say that as a cabinet member who has been there from the beginning, and my 5 years as Secretary of Health and Human Services has been actually quite exhilarating. David Elwood said to me today he couldn't believe I was so energetic and still enthusiastic about this job. However, there have been more bends, I think, than the Charles River, and I hope more successes than the banners that are hanging at the Fleet Center. But for all the joy and satisfaction of this particular job, I've had to contend with two myths about trying to run the Department of Health and Human Services. The first is that because the department is so large, my job is impossible. There are too many clients, too many internal conflicts, and too little public confidence. This job is easier than running a university. You should try to run a university where there are too many internal conflicts, too little public confidence, and too many difficult clients, and too many people who think they actually are in charge. The second myth is that a large organization like the Department of Health and Human Services is essentially a machine. If you pull the right levers in the right way, you'll get the right result. Not a chance. Between these two extremes, that nothing works and that everything can be made to work, lies a basic truth, that managing large, complex organizations is the art of the possible, that with talent and hard work and a talented staff, the possible almost always becomes probable, and then doable, and then done. Still, there are always lessons that you can learn along the way. James Cameron, for example, he was a gifted director, clearly, but he probably couldn't have made the Titanic for $200 million if he hadn't learned a few things making the Terminator for around $6 million. Cabinet secretaries have their own learning curve, and for me, the lessons came very fast and occasionally painful in our early days of trying to reshape the department to get our better information out to the public, to keep our science and technology second to none. Our failure to pass health care reform was a searing experience to preserve our promises to children, to the poor, to older Americans, to sketch out a working relationship with a new White House staff that was less experienced in many cases than many of us, all while trying to integrate a new political staff with an existing career civil service. And so here are, for tonight, Donna Shalala's 6 lessons of separation from the policymaking crowd. None are quite as pithy as the one Alan Simpson offered about how a public official should deal with the press. He said, when they're after your ass, pick up the phone. But I think I'll give you a snapshot of my own common sense rules about how to be successful if you're in the business of being a cabinet secretary and making public policy that affects almost every American. First, know your organization. Large organizations have many cultures, each with unique ways of doing things. Ask David and Mary Jo, because each of their sub-organizations within the department had fundamentally different cultures. When I became secretary, the personnel managers in the office of the secretary had overall responsibility for even hiring the distinguished scientists at the National Institutes of Health. Have you ever tried to apply standard personnel rules to hiring scientists? It works probably as well as hiring players for the Red Sox on their zip codes. So I transferred hiring responsibility where it belongs, with the top people at the National Institutes of Health. Second, make sure the right hand knows what the left hand is doing. First, know your right hand from your left hand, actually. Organizations have to meld their separate cultures into a large team. And one of the techniques that we used in the department to try to do that was to ask each of the top appointees to participate in the budget hearings of other appointees and to prepare a budget for the entire department at the end of the process. That meant that there was more interaction in the department and people had a better sense of what others were doing. I wanted them to see the forest from the trees by looking at the department the way I have to look at it as part of the budget process, but more importantly, how I have to look at it every day. Third, stand up for the people that work for you. I truly believe this. People behave at work pretty much the way they behave outside of work. Friendship, support, and loyalty motivate them. So showing people you care can really pay dividends. Probably the most searing personal experience that any of us had to go through as professionals was the closing down of the government. From a distance, it may have looked easy. For those of us that were involved in government at the time, it was devastating for the federal workers who had gone into government at least in part because they thought that the government would give them a secure position. And never in their careers had they ever thought that they might lose their positions or not actually get a paycheck. Our employees were scared. They had families to support. They felt their futures were uncertain. And we devised an internal strategy to reinforce and to reassure our employees during that period that, number one, we cared about them, but number two, we actually were fighting for them. I remember having an argument with the Assistant Secretary for Management and Budget when I wanted to send out a letter to every single employee. And he said, but we don't have anything to say to them. And I said, that's irrelevant. The symbolism of the Secretary sending an individual letter saying, this is basically outrageous, and I'm fighting for you, and you hang in there. We're all one family. We're going to go through this together, made all the difference in the world. Individual employees. We also got smart and did some very smart things. While the rest of the government, because we were told we could only cut half a paycheck before Christmas because we only had enough money to pay our employees half of their salaries, while the rest of the government were cutting paychecks for $7 and sending their employees, we sat down and figured out and asked a question that no one else in government had asked, and that is, do we have to take the deductions out in the first paycheck? And the answer was, there's no legal reason why you should, but everybody does it. So what we did with half the payroll, having only half the cash, was took no deductions, which meant every single one of our employees actually got almost their entire salary for that pay period just before Christmas. None of their other friends who lived in their neighborhoods happened to have a department that was smart enough to do that. But that kind of shrewdness made all the difference in sending a message to our employees that we cared about them and that we figured out a way to take care of them before Christmas. We said to everyone, I'm not only fighting for you, I told my press people to find any media that I could talk to because I wanted everybody in the department to see their secretary out there saying that closing down the government that was outrageous and talking about the implications of closing down the government. We calmed a lot of nerves, we motivated our employees, we made them loyal forever to this crew of people because we demonstrated that when they were really down, that we hung in there with them. Fourth, set firm goals and try to stick to them. There's an old saying that's still true, to govern is to choose. And the departmental priorities, which obviously reflect now the president's priorities, tobacco, children's health insurance, welfare reform implementation, cutting fraud and abuse, healthcare quality, fighting drugs and AIDS. Although we're further ahead in some and not in others, we're not quitting on any. But the larger point is this. Choosing priorities is not the same as choosing what's easy. So you have to be like a utility infielder. Go where the need is. Fifth, politics is always part of policy making. Policy is not made in a political vacuum, and that's why I really believe in being nice to Republicans. As David said to me earlier, it paid off. From the moment we walked into the department, I spent as much time with Republicans as I did with Democrats. I didn't have a clue we were going to lose both houses. But it seemed to me that we were going to need both parties to get the president's agenda through. So maintaining professional relationships with Republicans was just as important as maintaining professional relationships with conservative journalists. That included journalists from the Washington Times and the Wall Street Journal. In fact, I have two rules of thumb. One is to be fiercely loyal to the president on policy and appointments, and two is to be skillfully bipartisan in the administration of the department. When we go to Capitol Hill to testify, we present the administration's case as vigorously as possible. But when we return, we treat requests from Democratic and Republican governors with exactly the same professional consideration. And in fact, when I look back on the waivers that Mary Jo approved, we actually gave more to Republicans than we did to Democrats. But that's a very important distinction, and it frankly is why Senator Simpson can introduce me the way he does, as would, I think, many of the Republican leaders. 6, be flexible and realistic. In 1994, we lost on universal health care, in part because the other side organized quickly and framed the debate. And then the Republicans took over Congress in 1995. At the time, people feared that divided government was a recipe for gridlock, that Republicans were Republicans, that Democrats were Democrats, and never the twain could meet. That didn't happen. Instead, the change in Congress led to what I think was a healthy national debate on the role of government. The American people were obviously saying that they wanted some limits on the size and cost of government. The president heard that message and, of course, declared that the era of big government is over. But the president also believed and still believes that government has an important role to play in protecting the health and well-being of our children, in opening the door of America's economic bounty to all who are locked out, in preserving the promise of Medicare and Medicaid, in making investments in research, particularly in cancer and AIDS and a whole range of other issues which would pay off in life-saving medicine. We fought hard for this vision of America, an America that would live within its means without sacrificing its principles or its soul. And that fight was worth having. The days were long, the bargaining was hard, the compromises were sometimes painful. But what followed the changeover Congress in 1995 was a period of almost unparalleled legislative achievement. We passed major welfare reform legislation that we had to eventually fix. Thanks also to the booming economy, we brought the number of welfare recipients below 10 million for the first time in more than 25 years. Today, fewer than 4% of Americans are on welfare. But we wanted to do more than reform welfare. We wanted to strengthen families and make work pay. So early in the administration, we expanded the earned income tax credit, we raised the minimum wage, we made a multi-billion-dollar investment in child care and into the Welfare to Work program. We approved tough new child support measures that are expected to increase collections by $24 billion over the next 10 years. And last year, we passed the Children's Health Insurance Program, or CHIP, a $24 billion program to bring health coverage to 5 million uninsured children. At the same time, we strengthened both Medicare and Medicaid. We added new benefits, and we extended the life of the Medicare Trust Fund to 2007. And we're starting to see real results from new AIDS-fighting drugs. AIDS deaths dropped 44% in the second half of last year, and just a couple of weeks ago, we announced the overall cancer incidence and death rates fell from 1990 to 1995. And for breast cancer, we announced yesterday a major drug breakthrough, which will affect those people who are more likely to have breast cancer. All of this happened in defiance of conventional wisdom and with the smallest government since John Kennedy was president. Democrats and Republicans have worked together on blazing a trail towards fiscal sanity. We restructured Head Start and invested in the quality of the program with better training and wages. We cracked down on big-time fraud and abuse, and we're still cracking down. Childhood immunization rates have soared to record highs, and infant mortality in this country is at an all-time low, and the rate of children who are getting sick from diseases that we can immunize against are the lowest in the history of this country. Teenage pregnancy rates have declined for 5 straight years. Paternity establishments are up. Overall drug use among younger teens leveled off last year for the first time since '92. I'm not sure it'll stay there. But we all remember the line from the song in The Wizard of Oz, somewhere over the rainbow, bluebirds fly. Well, for years, we've been operating Washington on the theory that somewhere over the rainbow, a balanced budget lies. This year, we found the end of that rainbow. The President has submitted to Congress the first balanced budget in 30 years. Talk of deficits as far as the eye can see has morphed into the talk of surpluses as far as the eye can see. We have reached a new day, not of a limited future, but of a future that students across our country can believe in without limit. But that is the most important message I can bring you. I'm going to change somewhat the words of Martin Luther King, which he uttered exactly 30 years ago last Friday, because they express how I think we should view the next 30 years. There will always be difficult days ahead, but America is still the promised land. And I want you to know tonight that each of you can and will share in the fruits of this promised land. This is a time to be happy, not to worry about any barrier or fear any tomorrow. The glory of this great nation is just beginning. But remember, Dr. King saw a promised land, not a perfect land. So we must not expect a future without extraordinary challenges, or expect government to meet these challenges without help from business, from communities, from universities, from parents, from schools, from our religious community. But government does have a role to play, setting the agenda, leading the fight, and finding new and creative ways to win that fight. And at this moment in Washington, the number one fight in front of us is a fight against the number one preventable cause of death in America. I'm talking, of course, about tobacco. Today is World Health Day, but today, like every other day, 3,000 teenagers will become regular smokers. 1,000 will die prematurely from tobacco-related illness, and we're losing ground. A new study shows that smoking among high school students climbed nearly a third in the last 6 years, and 80% among African American students, 80%. We also have, though, the first president in history who's willing to take on big tobacco, willing to take on the industry to protect our kids. And we've sent Joe Camel packing. We've also set forth some tough new rules for retailers. No selling tobacco to anyone under 18. And last week, when I did throw out the first ball on opening day, I got to throw it out because the vice president's birthday was that day and he didn't want to do it. Last day, actually, when I went to the stadium, the reason I was at the stadium was not to show off my pitching arm. I was there to publicize a campaign to urge Major League Baseball players to stop using spit tobacco, to save their lives and save the lives of the children that they admire and those that see them as role models. Right now, though, the most important player in the fight to protect the kids in this country against tobacco is Congress. And the most important thing that Congress must do is to pull together and pass comprehensive tobacco legislation before going home this session. That's comprehensive tobacco legislation, not a piecemeal system, not partial measures. It has to include all 5 of the President's principles for effective legislation, including a measure to keep tobacco out of kids' hands, to keep the regulatory power of tobacco in the FDA's hands, and keep finding ways to remedy tobacco's impact on public health. I started off this evening with a simple proposition that no one, whether in government or the private sector, gets it right all the time. But by passing comprehensive tobacco legislation, Congress has a chance to get it right the first time. It's one of those rare chances, one of those rare occasions in public policy and in the history of this country for both political parties to rise to the occasion, to put nation above party and better the lives of millions of Americans. And so our message to Congress is this: don't you dare go home this season without passing comprehensive tobacco legislation. Don't go home without it. Since I spent most of today talking with groups of students, I'd like once again, I felt once again like I was a college president, sort of hanging around on a college campus, learning more than I was teaching, experiencing seeing the fellowship of the Academy and enjoying the honor of being a Heffernan Fellow, I kept asking my staff, who is Heffernan? And they said, don't worry about it, but I'd like to thank him or her, whoever they are. Under the stars of a beautiful spring evening in Cambridge, it's easy to forget why learning has its own rewards. How we use what we learn is much more important, of course. And so if those of us who make policy fail to build on the blessings of knowledge, if we fail to make evidence-based decisions, the fault, as Shakespeare wrote, will not be in the stars, but in ourselves. Thank you very much.
Donna needs to leave shortly after 7 to catch a plane, but we have time for about 15 minutes of questions. There are 2 mics. We will alternate. I don't think is there a mic up there? No. Okay, 2 mics.
Just yell.
State your name and ask a question, short question. Start here. Yes.
My name is Eric Chapsis. I'm a first-year student here at the Kennedy School. Senator Simpson opened up by discussing the Institute of Politics and that they should inspire students to go into public service, and it's increasingly getting harder. And you talked about your career, and certainly it exemplifies a career in public service. But I was wondering whether you could elaborate a little bit on how we can be inspired. I see my colleagues going out, a lot of them into the private sector and not very many into the public sector. How would you talk to us about inspiring us, more of us, to go into the public sector?
First of all, I think that when people talk about going into the public sector, everybody ought not to talk about it like it's going to be a permanent career. There are a set of us that sort of go in and out of the academy. I met students today that were doing what they probably didn't realize is very important work, working with their communities, making social programs work for people that are so discouraged that they don't know what their options are from all these investments that we've made. And I think that what those students are learning is what it means to be a good citizen in our community, and that it doesn't require a full-time commitment, whether you go into government or whether you join the Peace Corps, as Mary Jo and I did earlier in our career, or you go run a big-time campaign, as Maxine Isaacs has done as part of her career. But I can tell you this, that it's not just times in government. My 2 tours of duty in government were very different, but they were the most exciting things that I did professionally because they were so substantive. And it's not that you're not substantive as an academic, but you get to pull all the information together and you have to make a decision. You don't have a choice. You can't wait for more research all the time. You have to eventually pull it together. I will use the same answer for those of you that are going to ask me about needle exchange. You have to eventually make a decision. You don't have a choice. And if you want to participate in policy making, in trying to get a program to work, then government is the place to go. Whether at the federal level or at the state level, there are always going to be jobs for very bright, very able people that are committed. I think our civil servants would say that they have been empowered under this group, that they're having the best time of their lives because we're actually out there doing things. And it's not all making policy. A lot of it is the hard work of implementation or technical assistance to the states. And all I can tell you is that after 5.5 years, I'm still excited about it. I'm not ready to leave. Sure, I'd like a little bit more time. My tennis game would improve if I had a little bit more time. My throwing arm will not. 60 feet, 6 inches is my limit. It's my outer limit. But what I can say to you is that whether you go full-time or not, it will be part of a very rewarding career, and that you ought to do something to make a contribution, because that's what's part of being a good American. And more than that, it's part of what it means to be a good citizen. So you don't have to do it full-time, but you ought to do something to make a contribution to your community, because that's what a balanced life is about. When I look at people's resumes for jobs, I look at whether they've made contributions. You will be judged at the end of your life not by your MCATs or your college boards or your grad records or your grades or the quality of the papers that you turned in. I mean, there are some faculty members that will have read them. But but by your character, and that character, I insist, involves public service.
Secretary Shalala, welcome to the city of Cambridge.
Thank you.
Where despite the lack of federal leadership and the continuing ban on needle exchange, we have needle exchange program that has significantly reduced HIV infection among injection drug users, their partners, and their children. In this country, 33 people every single day are infected with HIV because of injection drug use, and there is lack of availability of clean needles. Since 1991, government reports have consistently shown that clean needle exchange programs work. We have the National Commission on AIDS, the Government Accounting Office, the Centers for Disease Control and Prevention, your own reports that show that. My question is, are you going to lift the ban, and when?
Yeah. Let me say 2 or 3 things. First of all, you're absolutely right. The AIDS epidemic is now being driven by intravenous drug users, and in particular, what is devastating and should be devastating to all of us is that 75% of all the children that are being born with AIDS are connected to an intravenous drug user. I believe that the research does indeed show that needle exchange programs work to reduce HIV, AIDS, to reduce infection. There is no question about that. However, the Congress of the United States gave me a different test. I have already communicated that information to Congress in a summary report that I sent last February, and all of us who have testified have said very clearly to Congress that comprehensive needle exchange programs as part of a larger public health strategy clearly reduce the incidence of HIV, AIDS, and there is confirming evidence. However, Congress didn't give me just that test. If they had given me that test, I've already reported to them. They gave me a second test, which is that, that these programs do not encourage drug use. And on that, I need to make sure, and the scientific review is going on now, that we can meet both tests. The first one is clear. The second one, the scientific evidence, is being assembled as we speak to make sure that we have looked at every single study. The one thing this secretary doesn't like to be is surprised by some study that comes out of the woodwork somewhere that shows the opposite of what she has concluded. So we are in the process of doing that. But let me say this to you. No administration has provided more leadership on the AIDS epidemic. No administration has had more courage. In our first year, we put condom ads on television when everybody said it would be politically disastrous to do so, but we thought that fundamentally this country had to get comfortable with targeted programs to a variety of different communities. We increased research by over 40%. We increased prevention dollars by 36%. We increased treatment dollars by 203%, and it will go up even more as we're going through. So I apologize to no one for our commitment, but I fully understand why people are seriously distressed over what they consider an improper delay in our ability to make the decision. But
can you give us any idea of time? Since that information is also available, there have been studies on that, the impact on drug use for 10 years as well.
The last person that put a time frame on this, let me say to you, I have no interest in this government delaying any more than we need to meet the test of Congress and to make the firmest kind of statement, nor does anyone in this administration. But when we make our decision, and Congress clearly didn't want to make the decision itself, so it set up these tests.
No
when we make our decision, we will be on the firmest possible ground to make the decision. So that's the commitment that I can give you. I also should say that no one has ever accused me of not being decisive.
Please do it quickly.
Thank you. Thank you. And thank you for your...
Hi, I'm Chris Brown. I'm a second-year student here at the Kennedy School, and I guess my question was about needle exchange as well, and I don't, and obviously I've been slightly preempted. I guess my question would be more now whether now that you've answered it largely, whether needle exchange is the kind of thing that's going to go on a back burner when tobacco takes the lead of the agency. I would imagine that it would be a heavier political lift given the work of tobacco ahead in the next few months to not take on something like this, especially since a lot of the evidence, as the previous questioner asked, points to the fact that drug use is not discouraged.
Right. Neither the department nor the White House has ever allowed AIDS, which is a killer disease, and I've just come back from a long trip abroad looking at AIDS projects abroad, will ever put AIDS on a back burner, ever. There is no issue that will substitute for our commitment to AIDS, to HIV, and to what I consider an absolutely deadly and devastating pandemic.
Thank you. Secretary Shalala, my name is Anna Kelly, and I'm a mid-career MPA student. I'm coming from a background in healthcare, and I'd like to know if you would comment on a practice that I'm aware of where the OIG is sending letters to hospitals, demand letters, giving the hospitals 1 week to 10 days to pay a fine based on surveys that they've done. And we're all very concerned about fraud and abuse in healthcare and very concerned about the rising costs of healthcare. But this practice of 7 to 10 days, I'd like to know what you could tell us about that and what you...
Well, I haven't seen any letters that say 7 to 10 days. It is true that the Inspector General, under the department's leadership, has launched a huge campaign to go after healthcare fraud. And let me tell you a story about that. When I went out on the healthcare reform debate in 1994, no one wanted to ask me about the president's healthcare reform plan. Oh, I might have gotten 1 or 2 questions in this kind of setting. Everybody wanted to talk to me about healthcare fraud. Senior citizens, healthcare professionals, everybody wanted to tell me about the system being ripped off. So we, in fact, launched a vigorous effort. As far as I can tell, even though there's some squealing going around, the final settlements are fair settlements. The hospitals in this country know what the rules are. There are some prosecutions going on of large healthcare companies. There are extensive investigations going on in skilled nursing facilities, in home health care. This country does not have the resources to cover more people with health insurance unless we make sure that we have vigorous efforts to not spend 1 dime more than we really should spend. And while the Inspector General or the people in law enforcement that are doing these investigations may not have good manners, either in the paper that they communicate, as far as I can tell, they are fair when the hospitals sit down with them, when they identify the reviews. And there are many hospitals, most recently Dartmouth and Yale, for instance, that went through reviews, and in fact, their errors were within the range of acceptability, and they got no fines. So I think that these are in part negotiations, but I just am not going to back off from our reviews of healthcare plans and hospitals and clinics and anyone else that thinks that they can rip off the taxpayers and take resources and use them in a way that's improper. Though I am fully sensitive, as someone who's run large organizations, that you have to have a margin of and an error rate that you're willing to find acceptable. But frankly, there's too much waste, too many errors in the healthcare system, and we need to get that money back so that we can extend the life of the trust fund. Last year, we brought $1 billion back, the largest amount in settlements in the history of the healthcare system. But we also don't intend to be unfair. So I think that the most healthcare professionals will find in the negotiations they're able to work these things out, unless they actually have done something wrong.
Hi, I'm a student at the college, and I just wanted to ask, this question is regarding an article I read last summer.
I want to hire all the students of the college that I met today.
An article that was in the New York Times that basically reported that, well, I'll paraphrase it, if the economy is growing at the same expansionary rate that it is now,
Yeah.
it would take approximately 40 years to absorb the number of welfare recipients who are currently living in New York. 40 years for the job market to absorb these workers, and once they're cut off that. Well, so in that context, I wanted to ask you about this 5-year limit that was placed on welfare recipients for federal funds. And one thing you mentioned was that because of the booming economy, a lot of people were moving from welfare to work. But when the economy turns sour, and when this 5-year limit ends, Do you think that Congress and the administration will have to reevaluate that 5-year limit when the states go up in arms over having to bear to single-handedly bear this burden of welfare workers who simply can't find jobs?
First, you've got an assumption that the economy is going to go bad in 5 years.
Not necessarily,
Not
but
necessarily.
you know, at some point.
Let me be fair to your question, because a number of people today have asked me about the safety net and what are we going to do if the economy goes down. What I hope we do is, before anything happens to the economy, is design something that's more like a trampoline than a safety net, that treats the people that are currently in the workforce like workers who have lost their job, so that it has broader political support, and that does what Mary Jo has been telling me we ought to do, and that is look at unemployment compensation and design a system that essentially catches people who have been working and then bounces them back as fast as we can into the economy. New York has a very special problem, but New York's way of dealing with this problem may not be as attractive to many people in social policy, because it wants to put huge numbers of people into workfare without the kind of energy that some other places have spent trying to create real links with a job market. But New York also has a very large number of people, and making a transition in this new world of welfare to work is difficult given its numbers. We always believed that we would not get it right the first time, that we would have to make corrections along the way, that we guessed a little bit on the exemption numbers, on how many people we thought could be exempted from the system. If we need to fine-tune the system at some point, 2-3 years down the pike, and if the governors have an idea of how they think we ought to fine-tune it, other than throwing money at them, but have demonstrated good faith efforts to work with their business community, I think that we will be doing some fine-tuning. But there's a difference between the economy going bad and the New York situation, which I think actually really takes, probably, Mary Jo's the expert on New York, but probably takes a very different kind of strategy given the numbers and the depth and the kind of market that they have than Iowa or Wisconsin or some of the other places. When you design national policy, you always end up with these exceptions at both ends, and you don't do it very well. Let me, yeah. Well, why don't I do the people that are standing up, but I'll do quick answers, okay? I'll try.
Hi, I'm Dr. Ronald Goldman. I represent the Circumcision Resource Center in Boston, and I'd like to raise this issue, which is getting a lot more attention these days. The United States is the only country in the world that circumcises most of its male infants for non-religious reasons, and no national medical organization in the world recommends circumcision. English-speaking countries, societies in those countries have called it invasive, inappropriate, traumatic, and unethical, and the American Academy of Pediatrics finds no proven medical benefit and some serious harm. So I'm asking you, what is your position on the issue? Why do you think this issue continues in the society where it is sort of an exception to standard medical practice, and what do you think government action should be?
I don't have a position on the issue, and no one has ever raised it with me before.
Well, it'll be coming.
Hi, my name is Seth Stern. I'm a first-year student here. In the President's statements in your speech today, you emphasized the success of welfare by the fact that the welfare rolls are down. And I'm wondering, is that the best measure of success, and is that what should be touted in public if it doesn't necessarily, reducing rolls doesn't lead to more independence for the people coming off welfare?
Good question. The answer is no, it's not the only measure. It's one measure and only one measure. The real measure is what happens to those families, what happens to those kids. And we won't know those answers for some time. All we know now, we know a handful of things. Number one, that there are a lot of people that have left the welfare rolls. Not all of them have found jobs. We know that we have not seen the race to the bottom, and most of the states are still making investments, or at least not cutting dramatically their resources. And we know that there are transitions going on in many states, and there's more energy from the business community building some partnerships. Beyond that, I don't think we know very much. And I don't think we'll know very much for at least a year. I've seen some of the individual state case studies, but I'm not going to come here to Harvard and tell you what Iowa is doing, because I don't think it's representative enough of what's going on. So we're a long way away, and I actually have been quite cautious in my major speeches on welfare to say that there's a limited amount that we actually know at this point in time. And I intend to be very tough-minded about those outcome studies that are going on in terms of our reporting to the public about what is going on. We want to know what's happening to kids. Go ahead.
I'm Emanuela Gakid. I'm a first-year PhD student in the health policy program. We debate this in our doctoral seminar, so we might as well know what's going on at the government. What kind of decision tools or decision analysis rules do you use to allocate between health risks for the American population? Because, for example, you mentioned breast cancer, HIV, and tobacco. Do you have a list of priorities, or how do you decide among them?
Well, the allocation of research dollars is actually as part of a formal process that the director of the National Institutes of Health does. So that when we do our allocation between certain diseases and certain institutes, there actually is a consultation process with the institute directors. But basically, research in this money is driven by the investigators themselves, and that's the way they apply. But clearly, there is some priority setting in the allocation within the National Institutes of Health. The other issues, that is, why do we choose welfare over comprehensive health, are basically presidential determinations. The issue of tobacco was ours. David Kessler, within 2 months of when I arrived in the department, came to talk to me about tobacco. And our initial conversation was that we had to shape it in a way that would make sense politically, but get us to where we wanted to go. And what struck me was the statistic that over 80% of all of the adult smokers in this country started as teenagers. So we decided to focus the program on teenagers. We took it to the president, and he enthusiastically said, let's go with the tobacco issue. So sometimes policy priorities come from Congress because they're interested. The first moves on women's health actually came from Congress. Sometimes they come through a formal process in which there's consensus, as there is at the National Institutes of Health. And sometimes they come from just good ideas because there are breakthroughs and strategies. We chose to do immunization and a number of the other things. We chose to do food safety because it became obvious. And sometimes it just comes up through the data or through the policy development process that David or Mary Jo or their colleagues would run, where we would identify issues. The biggest problem for us is limiting to a certain number of issues that you can actually achieve. Let me give you one more example. The president said to each of the cabinet, do something in conjunction with my race initiative. And so I went out and asked ASPE to develop a policy process, and we came up with the idea of trying to actually do something that was measurable, close the gaps between minorities and whites on a set of health indicators, a set of diseases, and pick the diseases according to things that really affect communities, whether it's diabetes for the Native American and the Hispanic community, or cardiovascular disease, or adult immunizations for the African American community. But we picked 6, actually, and then took away our safety net, the separate goals for minorities and whites that we've always had in the Healthy People 2000 goals, and said, we're going to mobilize the department the way we did on immunization and see if we can close the gaps. We're going to take existing resources, working with communities and with a set of partners all across the country, and see if we can close these gaps. Now that came up through a policy, through a broader consultation process, but the gutsy decision was to pull out the safety net and say, the Surgeon General and Peggy Hamburg, the former New York City Health Commissioner, who was David's successor, are willing to lead this. Let's see if we can actually do something measurable that improves the quality of life for millions and millions of minorities in this country in the major diseases that affect them.
Good evening. My name is Julie Burkhardt. I'm a student at the Harvard Graduate School of Education and a fellow alum from your alma mater. I want to thank you for providing women such an exemplary role model, and I was wondering if you could speak to the challenges you face as a woman throughout your career and how you've overcame those. In 30 seconds, right? Brief question.
Well, sometimes I took advantage of the fact that I was a woman and short, and sometimes I was discriminated against as a woman. I think that that I went to graduate school and went to school at an era when there were starting to be breakthroughs. Bella Abzug died recently, and all of us are in her depth. Bella was loud and noisy, but she broke down barriers, as has Gloria Steinem and Betty Friedan, a whole set of women that went before us. And they had to be loud so that we could be strategic and quieter. And I went to grad school when they were actually recruiting women because they my graduate professors at Syracuse at the Maxwell School believed that we would really get the shot at the job, so that I went at the right time. However, in my first job, my first academic job, the chairman of the department told me I would never get tenure because they never gave a woman tenure. So it's always been a combination of things for me, and I'm very much aware that I was pulled through the system by male mentors, not by women mentors, by male mentors. And that's why I've been a big enthusiast of young women getting both male and female mentors and playing that role where I could, particularly in my case with minority women and men who often don't easily find mentors to help them through the hierarchy of higher education. But some of those things that make you successful are also personal characteristics. It does help, as Ellen Simpson will tell you, to have a sense of humor when you work in Washington. But you need to be professional enough to know when to use it when it's appropriate. But I think for young women today, it's easier, but there are still barriers. There are still serious barriers, particularly in the world that Max and I live in. The world of politics still has elements of sexism, and that simply means that the more women we move into the higher echelons, the more it somewhat helps us. But I frankly have found very sensitive men to work with my whole career, and if they're not, I just tell them that they're feminists for the purposes of the period in which they're working with me. And but I think that as more of us demonstrate, I broke the glass ceiling for women in Division I, because when they look across the table at you, the boards of trustees, when they're trying to hire you for a big-time university, they have two things that they're worried about with women. Can she raise money, and can she deal with the football coach? And that was the glass ceiling for women. I demonstrated that I could raise a lot of money, and the football coach still is one of my closest friends. I fired the first one. Still is one of my best friends, because I don't see football programs as much different than first-class political science departments. You hire first-rate people, you give them the resources they need, you hope they have a strategy, and you develop something that's world-class if you're any good at what you do. But I see wonderful opportunities for young women, but people like me, like all of us, still have barriers to break down for you to make sure it really is an even playing field. Thank you very much. It was a pleasure to be with you.
I want to thank Donna and thank you, Donna. I hope we can get you to come back maybe next fall. And ever the optimist, I will say, if the Red Sox fall into a slump, we'll call.
Hi, nice to see you. See you tomorrow.